Hi, everyone. Welcome back to the YouTube channel. As I'm sure you've noticed, we did change our name from just the brokerage hardship real estate to Utah Non-Legal Probate Services. As do some of our other videos and looking, of course, on the YouTube channel, we offer a a la carte service to not only sell the home in an estate liquidation, but to also do estate sales, clean outs, and other after death care. Today, I have a guest from a company called Amazing Care. Her name is Amanda. She's going to tell us, of course, who she is, what she does, and a little bit about Amazing Care. So, Amanda, if you want to go ahead and start, I think that'd be great.
Yes, thank you so much for having me. I'm always excited to chat about Amazing Care. My name is Amanda Neely. I work for Amazing Care Home Health Services. I do marketing and business development throughout the state. So we actually have four offices from Logan to St. George, all throughout Utah, pretty much along the I-15. If we have a family somewhere along there, we usually can help. Amazing Care is unique in the fact that we offer home health services for the entire lifespan. So we do pediatrics, adults, and seniors. It is such an awesome resource that so many people aren't aware of that they can qualify for, whether it's nursing or physical therapy, occupational therapy, speech therapy, and it's all done in the home.
Okay, okay. So, are you like in-home health care? Are you palliative care? How would you describe it? Do you do those things?
So we're in home, but we focus on home health. So we're not palliative care, we're not hospice. We focus on helping people get back to a baseline of health. So typically it could be after an illness, it could be after a fall, after a surgery. We do help some patients who are chronically ill and are going to need assistance for their entire lives as well, but it's all about getting back to a baseline of health.
So it sounds like you're there for kind of a short term.
Yeah, so we are, again, it can vary because we do have some patients who we've been seeing for years. We help with patients that live in group homes is another population we serve. So we do have them. We are having to do recertification every so often, but it is more typically a short-term thing. So for example, this last year we had a 6-year-old on service who had been diagnosed with cancer, and we helped with some of the treatment for that in the home. But then once the treatment was concluded, we were no longer needed.
Okay. So this is interesting. I'm not a medical person, so my questions might sound very basic, maybe even. So you mentioned group homes. So do you go into assisted living and memory care to do services as well?
Yes,
Okay.
absolutely. So it's wherever the individual considers home, that's where we can go to. So we can go to assisted livings, we can go to memory care. Our speech therapist is actually memory care trained. So there's some extra training that can go into working with patients that require memory care, and she's phenomenal at working with those patients. So it's something to be aware of as well.
What would you say are some things that you guys do not do? Because it sounds like you do a lot, but what
Yeah.
are some services you don't offer?
So we do not offer non-skilled services. So all of our services require a medical professional, whether that's a CNA, nurse, physical, occupational, or speech therapist. So house cleaning, companionship services, meal prep, those types of things we do not offer. Medication management is something we can offer. And then, of course, all of the treatments and what have you from those medical professionals.
Yeah, so you're not like Susie's senior companion services or visiting
No,
angels. Okay. Okay.
right. We can work in tandem with them, but we are a skilled agency, whereas they are not.
So you said it's all medical professionals. Do you guys have social workers in your
We do have
employ?
we have a medical social worker, so that would be
Okay.
planning steps. It wouldn't be, excuse me, it wouldn't be like a therapist, like a mental health therapist, but it's a medical social worker.
Gotcha. I think I want to say when I was you host a monthly networking event. That's how I know you. at the central office of West Jordan, or one of the offices. I don't know if it's a central office. And I want to say y'all just had what, your 30th anniversary or 25th or something like that of being in business?
Yep, our 20th anniversary is this year. So we
Okay.
are in 3 states. We are in Utah, Colorado, and Texas. And
Okay.
Colorado
Oh,
is
you're
our
in.
flagship state.
Oh, I see. I see. Okay. Colorado is where you originally started. Interesting. Interesting.
Yeah.
How long have you been in Amazing Care?
Just about 2 years. It'll be 2 years in the
Okay.
spring.
And you do marketing, you said, and like development and stuff. What does your like day look like working for Amazing Care as a marketer? I'm always interested to hear this sort of thing
Yeah.
on the channel.
Yeah. So my days can be they vary greatly. So the biggest function of my job is to build relationships with the people who are encountering patients that need our services. So that might look like case managers at hospitals. It could look like nurses at assisted livings. It could look like we work with a lot of government agencies is the other piece of our business because we work really heavily with Medicaid. And so we can partner with a lot of government agencies who are seeing that population as well. So it's connecting with all of these people and making sure they're aware of what we're doing. So I'm dropping by a lot of places. I do a lot of lunch presentations at doctors' offices. I do coffee runs for different agencies. It's all about maintaining and building relationships.
Yeah, yeah, it's in the car a lot, I imagine, right?
Yes, in the car, I send a lot of emails. I have a lot of phone calls. It's really rewarding. I think for me, it's important to me to work with for a company that has heart and that is doing something that I feel is worthwhile. So I mentioned earlier in our conversation the 6-year-old that we did home health services for. He had cancer and their family was so greatly impacted by that. So as any family would be, but particularly they were a one-income household. They did not have a lot of extra funds to manage everything going on, let alone extra time. The dad was disabled and wheelchair bound, and the mom was working full time. And so for us to be able to go into the home and provide the services that they would have had to otherwise go somewhere for was huge. And I actually got to attend his bell ringing ceremony at Primary Children's. So when somebody is considered in remission, they get to ring a bell. So I got to go with our nurse and watch him do that. And so it's those little stories that are just so rewarding and so cool to be a part of in any way.
Awesome. Well, these are pretty short videos. I'm curious if you have anything else to share about Amazing Care before we wrap up. And of course, after you share some of your final thoughts on Amazing Care, I'd love to hear how we can best find Amazing Care online.
Yes. I just say that Amazing Care strives to be a resource. So even if we don't end up being the agency that can help, we most likely know an agency that can. And so we would love to, we're always available to hop on a phone call, correspond via email or text, and help you find the care that you need. And then Amazing Care is just at amazingcare.com. So pretty simple. And we have all of our locations throughout those 3 states listed on there with our contact info as well.
Wonderful. Well, thank you so much for coming on the channel. Of course, you and I are going to chat real quick after we stop our meeting. We're just going to chat here on the Zoom after we stop recording. Folks, of course, if you have any questions, please feel free to reach out to Amazing Care and Amanda, or you can comment below. Please share, like this video. We are slowly growing over the past year. We've put out a lot of content and hope to continue to have more guests. Thanks so much. Until next time.